What happens in hemodialysis? To keep it simple, two main things happen. First, the blood is cleaned. Second, excess fluid is removed. People who need hemodialysis often have a buildup of waste products in their blood, extra fluid, or most of the time, both. How does hemodialysis work? Blood leaves the body and goes into a device called a dialyzer, which is sometimes called an artificial kidney. Inside the dialyzer, there are thousands of tiny hollow fibers. Blood moves through these fibers while a special fluid called dialysate flows around them, usually in the opposite direction. The walls of these fibers act as semi permeable membranes. They allow certain small substances, such as waste products and electrolytes, to move across while keeping blood cells and larger proteins in the bloodstream. This is where the blood is cleaned. Dialysis can also help correct certain electrolytes and acid base imbalances. The second function is fluid removal, also called ultrafiltration. The dialysis machine creates a pressure difference across the membrane, called transmembrane pressure, which moves excess water from the blood into the dialysate. The dialysate is made using highly purified water and carefully controlled amounts of electrolytes and other components. As it passes through the dialyzer, it helps remove waste products and excess fluid from the blood before leaving the machine. The doctor prescribes the dialysate. The amount of fluid to be removed is set before treatment and may be adjusted based on the patient's condition and how they tolerate dialysis. In simple terms, hemodialysis acts like an artificial kidney, helping clean the blood and remove excess fluid when the kidneys can no longer do these jobs effectively.